Hi, folks. This is Rob Ray, CEO of BlueStar TeleHealth. I'm talking to you from our palatial headquarters here in Rockville, Maryland, and it's a Friday afternoon on March 25th. This is an update. I had a great lunch yesterday with one of our longtime shareholders and a dear friend, Chris Nordine, and Chris was asking me how things were going at BlueStar, and I gave him a lunch update, and he said, "Wow, I didn't know all this stuff." And I said, "Well, heck, I've been sending notices and things." And so I've decided to try to recreate the lunch update for Chris for all of you. And there'll be a little bit of homework at the end, but not much. So this is a one-take wonder. I'm going to share my screen, go through some PowerPoint, and then we'll be happy to answer any questions via email or text or phone. Okay, here we go. Okay, information for shareholders. This is a graphic representation of yesterday's lunch, and we're going to talk about an overview of the company and where we are. We'll talk about how we're growing. We'll talk about this upcoming recapitalization. And then the homework is the action requested on your part, which is actually pretty light. So don't freak out about it. First, overview. And I'm going to go fast because you're a smart group. Just a refresher for those of you that haven't been paying attention lately. We've been around doing revenue since 2015, keeping Americans safe, healthy, and connected, serving 5,000 families. We have about 30 B2B telehealth clients now, hospitals, federally qualified health centers, physician groups. We've won lots of awards from the SBA, from the governor, from the Better Business Bureau. And as you know, we're a military veteran kind of centric company with lots of admirals and generals on our advisory board and 44 admirals and generals as shareholders, including 6 presidential appointees. We started our business back in 2015 by selling senior tech to consumers. We were trying to keep people safe, healthy, and connected. But now we are focusing on 2 specific forms of senior technology in the home. One is remote patient monitoring. It has hardware and software in the home, just like senior tech. It includes, though, nurse monitoring, and this connects caregivers, physicians, and hospitals with their remote patients at home. 30 million Americans need it. It's a huge growing industry, growing rapidly. And the other thing is chronic condition management. Lots of people have chronic conditions, about 100 or more million Americans do. And we're taking care of them using software and nurse monitoring, again, to connect the caregiver with the patient. The key differences for us is that this is business to business, not direct to consumer. And so a sale might be $250,000 a year instead of $500 a year. And we get funding from the healthcare system, not from families. It's a rapidly growing industry. Telehealth is the future of healthcare. They're saying it could be as much as 25% of all healthcare. U.S. healthcare is the biggest industry in the universe that we are aware of, growing rapidly 40%. And the quote in the lower left-hand corner is from someone in Chicago that runs an investment bank that works in this area. He said, telehealth is exploding. RPM is exploding faster. The space is white hot. The pandemic broke down all the barriers. It's all about trust in delivery, which is why caregivers are looking for a trusted player like BlueStar. I did not write that, and I did not pay him to say that. He said it on his own. And on the right-hand side, you can see that Americans are using telehealth, that the pandemic has rapidly accelerated the use of telehealth. 60% of seniors are ready to use telehealth to manage their chronic conditions. 50 million Americans said they'd switch doctors to get more telehealth. So it's the way of the future. This is what BlueStar does. On the left are hospitals and doctors. On the right are patients in homes. And we're the middleman or the middle people. Okay, we connect the patients with their doctors and with their hospitals. And that's us in the middle. We provide hardware, software, nurse monitoring, logistics, program management. And we get paid through the healthcare system. Before, BlueStar was getting paid through credit cards from family members. So Medicare, Medicaid, health insurance, they provide the money to the doctors and the providers for the work that we do. And then the doctors and the hospitals provide us some portion of that. Clients want the full service suite. These are the 30 or so steps of remote patient monitoring. It starts with enrolling the patients, then activating them, shipping them equipment, training, making it all work, system operations, hardware, software, tech support, alerts all through the month, monitoring, having nurses and medical teams look at the data and escalating it when conditions are appropriate. And then finally, 5 is follow-up. Of these 30 things, BlueStar does 27 of them. And the clinical provider only has to approve people to be enrolled in the program and then to do the clinical follow-up when it's over. Here's our good-looking management team. We're up to about 25 people now. Several of these folks are new. Dr. Michael Rowley, our Chief Medical Officer, Sarah Flanders, our Chief Nursing Officer, Elliot English, our Director of Telehealth Ops, and our Board of Directors. So, growth. We're growing in 3 ways. Number 1 is telehealth. It's primarily remote patient monitoring and chronic care management, okay? And we sell to health centers, physician groups, and to hospitals. That's our main thing. We're called BlueStar TeleHealth for a reason. Number 2 is our legacy senior tech work. We still have about 3,000 direct-to-consumer families that we're providing senior tech services to, but we're not working at growing that. And then we have number 3, and a distant third, is a variety of miscellaneous efforts that are sort of adjacent to this space. We participated in a $1 billion VA bid, which will have 4 awardees. If we are one of the awardee teams, we're just a small player on a big team, that could be $6 million a year in revenue to us, which would essentially quadruple our revenues overnight. We're supposed to hear about that in the next few months. We're participating in a bid for Optum United, which might be $1 million a year for us. Another member or another company has asked us to partner with them for a Maryland Medicaid, Medicare information management system partnership. And then we have medical supplies partners going on. But our main thing is telehealth. And there's 4 main steps: acquiring clients, onboarding clients, growing their patient population, and then ongoing operations. Client acquisition, what we do is we source leads on the left-hand side. We do emails, direct mail. We do referrals. We have channel partners. And then we make a Zoom pitch. It's a half-hour pitch. Dr. Rowley and I do it. Sometimes Sarah Flanders will join us. We have a 9-minute PowerPoint presentation. And 50% of the time we make that pitch, people sign up. They sign our letter of intent. And there's a lot of folks out there. 7,000 hospitals, 100,000 physician practices. Right now, we're knocking it out of the park with federally qualified health centers. I think we have a dozen that are members or that are clients of ours, only 1,488 to go. Then we onboard clients after we acquire them. And that's an assembly line. And we have account managers and teams that take the client over from the client acquisition team. They do a kickoff. We learn about the client through discovery. We build a plan for them that includes hardware, software, monitoring, logistics, all that other stuff. We get them to approve that, and then we execute the plan, which includes some contracts and training their staff. And at the end of that onboarding, we have the first patient signed up in the program. The next step then is to grow the patient population. And that's a different assembly line with many of the same people, but with many different people. We get the patient growth plan approved by the client. Then we generate a bunch of collateral materials, everything from posters on the wall to emails that go out. Then we do outreach communications of a dozen different kinds, including postcards and direct mail. And then we call, and then we identify who is going to be a volunteer. We sign them up, and then we ship them equipment, activate them, and get them going through training and setup. And then lastly, once we've got these patients on board, we have to operate, the system and take care of the patients, which is our number 1 priority, is monitoring for patient care. So we have an in-house team of nurses and medical assistants. And right now it's at 5 and we'll be at 6 in a few days. And we're probably going to have to add 2 people to this team a month for the rest of the year. We have our existing support infrastructure from our legacy business and senior tech, shipping, tech, IT, customer service. And then finally, we have client relations, and we're building an account management team also that will interact with these hospitals and health centers through program management and client interaction. So these steps are now generating patients. It's been a while. It's been kind of a long gestation period. We We planted these seeds and we've been watering them and fertilizing them mightily, and now they're finally starting to grow, to bloom. You can see here this list of, this is by month, going back to the beginning of this past year, where we had 0 clients, and then we worked our way up, and now we have about 30. Not all of them are shown on this chart. This is our backlog or pipeline. This is a list of the hospitals, the FQHCs, and the physician groups that are existing clients. And these are the patients that they think that they want to be able to add during this year. And if you look at the lower right-hand corner, they think they could add up to 22,000 patients. And our goal by the end of the year is to get 4,000 of them on board. So this is existing clients that we've signed papers with. None of these are projected future hopeful clients. These are actually folks we're currently working with. 22,000 patients, we're going to try to onboard about 20% of them by the end of the year, or 4,000. Remember that 4,000 number, it's important. So you can see that we've been this is before the things were flat, before things started to sprout, but now they are sprouting. And we actually, was talking to Elliot a little while ago, we actually might beat these numbers as we get out into May. We see getting to 1,000 patients in May. We have 5 clients that could make we could shut down the other 25 clients and just work with these 5. And they have 30,000 patients that have high blood pressure, and they have government funding to provide services to them. And they have signed deals with us to provide those services. Okay. If we got 25% of those people to participate, that's 7,000 patients just from those 5 clients. Remember, our goal at the end of the year is 4,100. Here's another way to show getting to 4,100. The top line shows that we'll add, 200 patients in March and 250 in April and 300 in May. Okay. And at the end, we get to 4,100 patients by Christmas time. That will triple our current revenue rate. Notice that we want to be adding 350 a month by June. Well, this week we're already enrolling at that pace. So again, we're ahead of projections. And this is what we think will occur. You can see the 2 colors of revenue on this chart. Blue is our legacy senior tech revenue. It's slowly declining at about the industry averages for those kind of populations. And then the red is the telehealth. And you can see that it's rapidly growing in accordance to the charts that I showed you earlier. Okay, we're going to have a recapitalization event in 2022. You've heard me talking about it before. Well, it's finally happening. In the past, we raised money from many of you that are listening to this, equity. We raised about $4.5 million between 2015 and 2017. And then we raised an additional about $2.2 million over the years 18, 19, and 20 in the form of convertible debt. That was debt from shareholders and investors. And the idea is that it would convert to equity at some future event. Well, this is that future event. April 22, we're going to be doing Growth Series A, which is just a different name of the preferred shares of stock to keep them in track. And we're going to raise $2.5 million in new cash. And then we're going to convert the convertible debt people that want to convert. Here's the summary of the recap. It's going to be about $2.5 million in new cash at $3.50 a share. It's going to be about $2.2 million in third-party debt that will be converting to equity at that same share price. It'll be another $2.2 million in shareholder convertible debt that would convert to equity. There'll be some write-downs on some of the other debt, and then we're going to bring in a new senior lender to replace Treehouse Private Equity as our senior lender. Treehouse has been wonderful to us over the past 5 years. Unfortunately, Mr. Treehouse died, and they're closing the private equity shop. And so they don't want to be our lender anymore because they're trying to move on to other things now that circumstances have sadly changed. In addition to the financial recap, we're going to, at the same time, increase the board to 5 members, and that will allow us to bring on some additional board members with healthcare experience. These are the institutional investors that we expect to participate in this round. Ziegler Linkage Fund is already invested. J&B Medical has already invested in the past. Driehaus has invested in the past, as well as other shareholders listed down at the bottom, all of whom have invested and have participated in the convertible debt offering. Here's the recap in as good a picture as I can draw, given my limited PowerPoint capabilities. Look at the lower left. We'll start with new equity. There'll be conversion from shareholders. There'll be conversion from debt holders. There'll be a write down of some of the senior debt. There'll be new debt to take out the Driehaus fund, and then we'll be ready for future growth. And you can see in the upper left-hand corner, we have some cash on hand and a lot of debt. And in the upper right-hand corner, when we're done, we're going to have cash on hand to allow us to grow more rapidly, and then a much reduced debt. The balance sheet will look much, much better. Game plan for the next 24 months is get the recap done over the next 6 months to continue to grow to 4,100 patients by Christmas time, grow to 12,000 patients by Christmas of 23, and then be acquired in 24 and deliver the return to investors that, frankly, I promised to deliver to you folks already by now. So I'm behind, and we got to make it happen. Okay, action. Here's your homework. Action requested now. We are going to be sending you a consent form. And if you're a common stockholder, the consent form will just say that you are good with us increasing the size of the board to 5 members. If you're not good, don't sign the form. For preferred stock, we're going to be asking you to sign the consent form to authorize increasing the board to 5 members, and then also issuing additional preferred stock. We have kind of a rule that when we're issuing more preferred stock, the preferred people get to vote on whether or not that'll happen. That has always occurred beforehand, or as we've done preferred stock in the past. And then for those of you that are holders of convertible debt, which include the WeFunder group, you don't have to do anything just now, okay? We don't need or require your consent to do this board thing or to issue the stock. It was implied with the paperwork that you signed when you did the WeFunder deal. Then, after we get the consents, we'll move forward to a closing. And I'm shooting to have the closing on the 30th of April or the 1st of May. At that point, if you're a common stockholder, there's nothing for you to do. If you're a preferred stockholder, there's nothing for you to do. And that's when the convertible debt people get to do something. If you're a WeFunder, you'll automatically convert because those were the terms of the deal when you signed up with WeFunder. If you're not, if you're a previous BlueStar shareholder that signed convertible promissory notes, we'll send you information indicating your option and what you want to do. And then we'll say, do you want to convert? Yes or no. Doesn't have to be done on May 1st because we're going to have this window of a closing. So stand by for more information on all that. And that's it. I tried to make this as quick as possible. I didn't want to bore you. If we went too fast, happy to cover this on the phone. The best way to reach me is to, send me a text or an email, and we'll set up a time, and then we'll have a nice chat on the phone. I'm always happy to talk to our folks, and I appreciate your time. Okay, let's see. I'll stop sharing, and look forward to talking to you. Sign those consent forms, get them in, please, if you can, so that we can check those boxes off, and then stand by for additional paperwork that will fill you in as we get closer to the closing. Okay. All right. Everybody have a great weekend. Good luck with your NCAA brackets. Mine's completely busted.